My background, I'm an internal medicine physician. I was trained here in the United States in New York, and then I practiced internal medicine for 11 and a half years in San Antonio, Texas. So I'm a Texas born here. My two boys are from Texas, so it's really great for me coming back here. So I went back to Panama 5 and a half years ago, and I got involved with adult stem cells through a common patient friend of mine who had a heart disease, and he got treated. He improved dramatically, and that's how I learned about what Dr. Riordan was doing with adult stem cells, and it blew me away because really there's a lot of ignorance, and that's really what I tell a lot of people, even through physicians, because actually my knowledge was really basic until I knew what they were doing, and it really got me interested to see why this has not been advanced as much as it should, and it really got me excited of trying to do something in Panama, and that's how we ended up working, and I'll go briefly of what we're doing there. These are some of the conditions that we are commonly treating in Panama with adult stem cells, and there's many others. You know, we basically review every case that we get applications from, and we have a medical advisory board, so we really discuss the cases, and that's really important. Each case is individualized, and there's different things that make a big difference into determining if a patient is a candidate, because actually we probably refuse more than 60–70% of our applications. A lot of people think that adult stem cells can cure everything, and we wish it would, but it's definitely not the case. And we are clear with patients. We really feel it's a great option, and as has been discussed before, the science behind it. But we are really clear with the patients that, you know, there's really no promises, because there are factors that we really can't predict. But we know, and we feel really comfortable with the results we're getting with these conditions, that the results, you know, speak for themselves. So again, Stem Cell Institute is located in Panama City. It was founded around 2007. And it's a private institute, and the important thing when I talked to Dr. Riordan the first time is I wanted to make sure that we can do this, you know, understanding all the obstacles that adult stem cells have because of everything that was exposed. We wanted to make sure we can do it in Panama. Unfortunately, we found a law that was against embryonic but in favor of adult stem cells. So it was amazing that we got that. But at the same time, we had to present our clinic to the FDA equivalent in Panama, which we did. So we are fully licensed, and that's really a really important issue for me as a physician. If I was going to get involved doing this, that we were going to be able to do it basically the correct way. And that's a really important factor that I emphasize to patients, that we're doing something here totally acceptable in Panama. There's been obstacles, like, you know, obviously through medical ignorance, but we are slowly educating not only patients but physicians, so they actively understand the difference, first of all, of adult stem cells and embryonic, and what the science behind it, because a lot of physicians still feel that it's only stem cells or adult stem cells is for the hematopoietic part that we talked about, leukemias and all that. But we said there's a lot of clinical evidence out there that is showing the benefits in these conditions that we treat, not only through what we've studied and we've done, but through other research facilities. So that's really important to emphasize. So Stem Cell Institute is located in Panama City. I think there was a nice initial presentation of where Panama is. A lot of people still weren't clear. We are a really developed country, and Panama has grown exponentially in the last 5–7 years. Economically, a lot of businesses are coming to Panama, and the medical aspect has grown really, really amazingly in the last several years. So we have a lot of American-trained physicians. Our facilities follow state-of-the-art care, and that's obviously something that we emphasize to patients. Sometimes they're afraid of where they're going and what they're going to what kind of country this is. Well, we're really developed, we're really Americanized, and that's something that we emphasize to patients. Panama City, as you see, is a big metropolis. It almost looks like a little New York. We've grown a lot, maybe too much for my taste, but it's a wonderful city, and it offers an environment that promotes a lot of advances, in not only in the medical field, but many others. Obviously, we're famous for the Panama Canal, so I can't, talk about Panama without mentioning the canal, which is one of the wonders of the world. So we follow our lab that was mentioned by Dr. Riordan is, for us, it's really key. We were in a place in Panama called the City of Knowledge, which is a techno park that we had to go through their procedures to get approval. And so it's a wonderful facility that promotes technology companies that are not only in the medical field, but any field. And for us, it's really important that we were able to get established there, because it really promotes the growth of what we're doing. And so we're really excited that we were able to do that. And this is the area where all the cells are processed, and that's really the key. A lot of times we want to say it's our healing hand that helps the patient, but it's not the case. It's here, in the lab. That's where they process the cells and makes them do what we want them to, which is help to control the conditions that we're treating for. And we follow, again, American standards of care, and for us, obviously, that's key. And we tour the lab for a lot of patients. For them, it's a really peace of mind when they see the facility from the cells that are being processed are done. This is how they characterize the cells, and it's really an amazing process, and it's really incredible that this is being done. A lot of the cells are frozen, the cells that we don't use, and we'll talk a little about that, and liquid nitrogen. This has been talked before, all the publications. For me, as a physician, that was really important when I got involved, as to where's the science into all this, and promoting it to the day you can present it to physicians and say there's medical evidence. And that's something that our group has been actively pursuing from day one. It's not only treating patients, seeing the results, but really documented it by presenting this in clinical publications. And we have the rationale for a lot of what we do in these peer-reviewed journals. And one other thing that's really important, because a lot of physicians may say, well, where is the clinical trials? Obviously, it's very hard to do clinical trials on adult stem cells because of what has been talked before. It's a political thing. It's a lot of the studies that we have today are sponsored by pharmaceutical companies, and there's really no interest. So it's very hard to do, but we've been pursuing it, and that's really an active thing that we want to continue doing, because we know in the medical field things are black and white, and if you can document what we already are seeing, it will be great for us. And we're fortunate to work with really important groups in the U.S. and hopefully in the very near future do very groundbreaking clinical trials. This was mentioned already, the type of cells are found in the fat, so I won't go again through this. The procedure that was explained, the liposuction, done by board-certified plastic surgeons. A little gross here, but that's really the fat that's obtained from the procedure. And we separate, obviously, the fat to obtain the active area, which is called a stromal vascular fracture, which are where the cells are found in the fat. The administration procedures are typically intravenous. Some are intramuscular, depending on the condition. Some are intrathecal, which are in the spine, depending on the condition we're treating. And some are in the joints. Some also are done by catheterization in cases of diabetes or problems with circulation or kidney condition. But the majority are, all these procedures are outpatient. So that's really important. These are... The liposuctions are done in facilities, and but the patient goes home or to the hotel the same day. The cases where bone marrow is involved, again, the patients are, it's done in a surgical center, but they go back home, and the recovery is really quick. And the rest of the procedures are done in our clinic. You know, we have also a board-certified anesthesiologist who does the lumbar punctures in the clinic, and the other ones are intravenous. So these are pretty simple. Actually, a lot of it is anticlimactic. When the patients say, well, that was it, you know, it's a matter, it goes in 5 minutes, but the cells go in, and so it's a really simple procedure, and it's safe, and that's really something that I can't overemphasize. I'm just going to touch briefly in some of the conditions without going in detail, but basically arthritis is a condition that we really have been having great success, and it's pretty simple, and that involves just a liposuction that we talked about. So we process these cells, and then they are administered in the most affected joints that the patients have, and the other ones are administered IV, because a lot of times they have other joints involved, so applying them through the IV route will reach other joints that were maybe not as affected as, let's say, knees or hips or ankles, etc., and the benefits are there. And the amazing thing, and that goes back to what these cells do, is help with inflammation, and they help to repair other things that the patient may not have been aware of. And that's really the amazing thing that we have been seeing in people that come for a specific condition like arthritis, and then we see benefits in their skin, in their stamina, in their hair, etc. So all these things, their nails. So there's some benefits that obviously these patients get, not only for the condition they have, and that's when we know that these cells, again, home to these areas of damage, which in some cases could be primarily a joint, but they go to other areas. Multiple sclerosis obviously is a tough condition, and you know, adult stem cells have proven to be very effective. You know, we're selective. As we all know, there's several types of multiple sclerosis. I'm not going to go through the categories and all that now. Basically, we review every case and we discuss it with the patients. Typically, the stay is 4 weeks, and we administered, you know, all the way from 10 intrathecal injections to 2 to 3 IV injections that come from the fat and from allogeneic cord blood. The combination, and that's something that was touched before, of using the fat and using the cord blood, the synergistic effect is what really helps a lot, is adding benefits from using these two types of cells that each ones have their own effect. And without going in detail specifically what they do, but we have found that combining therapies in a lot of these conditions increases the odds of improvements. We do physical therapy, and I can't overemphasize the importance of physical therapy in neurologic conditions, not only before, during, but after the treatments. And we have found that it just activates the stem cells to go to the areas of deficit. So that's something that we have a facility where patients go and get the physical therapy while they're getting the treatments in our clinic. We treated over 200 patients, and we've had pretty good success. Obviously, there's some patients who their condition is more aggressive, and they've had to come back, and they get significant benefits that maybe initially they didn't get. So that's something that we obviously explain that to patients, that they may have to come back, especially any condition that there's problem with their immune system. Stem cells, adult stem cells can help you so far in controlling that immune system, but in some people, their immune system is more aggressive. So obviously, they get some benefits, but coming back, and understandably, it's hard for some patients to come back, but the benefits are there. And this is, you know, just autoimmune, which obviously MS belongs to that category, but in rheumatoid arthritis and other conditions that were touched before, the treatment involves just applying the fat cells that have that capacity, as we talked, to control the immune system and to repair. And it's simple. We do the lipo, and then they get 3 injections of their own fat stem cells. And in some cases, when there's significant joint involved, we can go directly to that joint, and the results are pretty dramatic. I think we have one lady that we treated recently, and she's done really great. Heart failure is another condition that we've had really good success, and we use other type of cells. The rationale is mentioned here. There's clinical trials ongoing showing the efficacy of these cells to home to cardiac tissue, and it's really amazing results. And this is something pretty objective. You have an echocardiogram, which is a heart monitor on a patient that shows how their heart was doing before, and we followed our patients after the treatments and with the echocardiogram, and it showed really, in some cases, dramatic improvement. So it's really a condition that we feel that it's helping a lot of these patients. And the nice thing about it is you don't have to be that aggressive. The IV route is sufficient, we feel, to get these cells to the heart. And there's several studies, and I think there was mentioned already that these cells, again, home to areas of inflammation, and there's ways to even improving that by the type of cells that we use and by using ascorbic acid or vitamin C that has been shown to have or to convert these stem cells to cardiomyocytes, which are the active cells in the heart. And we have obviously publications documenting that, which is something, again, that we can't overemphasize. Autism, and I'll label that also with cerebral palsy, are conditions that, well, autism, I think, is still poorly understood. There's still so many theories of what is the trigger, what is the cause, but we know that the common denominator is there's inflammation involved, and that's the key word that probably all these conditions share. Inflammation is the trigger. These cells will go to areas of inflammation. In autism, we know there's issues in the gut, and that's where the MSCs, or the mesenchymal stem cells that were mentioned before, can help significantly with these kids that a lot of their problems are gut mediated. A lot of these chemicals that affect brain function are starting from there. So we've been seeing some dramatic results with autism. It's a tough condition, but we're really excited with the results we've been having, and that's why something that we keep pursuing. We are hopefully starting talking about clinical trials and are really interested into promoting that, is starting a clinical trial in collaboration with NYU. They've seen a lot of what we've done, and they are excited of hopefully doing something. It's a lot of hard work doing a clinical trial when you don't have a pharmaceutical company behind it, but that's something that for us is really important to do. So this is a condition that, again, we're really excited. Basically, the difference in younger kids, we only use IV route because their blood, what we call the blood-brain barrier, is still really mature, so the IV cells are sufficient. In older kids, we use the IV route plus the lumbar or the intrathecal route. This is just a cartoon postulating the mechanism of these cells that were mentioned before, the CD34s, and how they can help repair by creating new blood vessel growth. And by that mechanism, they can help deliver all these cytokines that we talked about before that are helpful in the mediation of repair. So that's really a big mechanism on why these conditions improve. Spinal cord injury has been really an exciting condition that we've been treating with really great success, and obviously it's a devastating condition. And but as mentioned before by Dr. Riordan, the mechanism was already mentioned of how it works. We do, again, we can't overemphasize the issue of doing physical therapy, which is a key part of spinal cord injury as with MS. Well, we have seen that the younger the patient is, the better outcomes they have. The fresher, meaning the lesion, typically in less than a year, we've had almost 100% improvements, and some dramatic, like the case exposed with Juan Carlos Murillo, but we've had several more in that have improved significantly, and more that we have treated recently that are improving. Because of that, again, talking about clinical trials, the project, the Hope for Paralysis at the University of Miami, were really amazed at what we were doing, and so we're in the process of finishing the paperwork to do a clinical trial also. So that's really exciting. After they reviewed the data, they looked at many centers because they knew what adult stem cells could offer, but as mentioned before, that were frustrated because FDA kept putting roadblocks, and even in them knowing that this offered a great opportunity for their patients. So they looked to us, and they were really excited what we were doing, and we were really transparent, and that's really a key thing. We have records of our patients, so after reviewing that, they decided they wanted to work with us. So that's really something that makes us really proud that a high prestigious entity like that wants to work collaboration with us. I mentioned here anti-aging, simply saying that these benefits that these cells do, they help to repair. So if you look at the aging process in general, it's a process of inflammation that causes cell damage. So using these cells to repair your own cells, even if you don't have a significant condition, makes sense. And we've had some, again, really impressive results with what we mentioned. Here, briefly, because there's a lot of future possibilities of what stem cells can do. This was an amazing study on rats that had breast cancer, metastatic breast cancer, which is devastating. And just by admitting these famous MSCs to the rat, found eradication of the tumor or total resolution of the cancer. So it's really a promising and something just to put out there that in the future it may even have some benefits in some type of cancer. Obviously it's too early to discuss it, but it sounds really promising of what these cells can do to repair even in conditions as devastating as cancer. And this is one that I'm interested heavily on, is hair growth stimulated by stem cells. So I'll tell you if it works in a couple of years. So again, the same process. It's an inflammatory process. These cells help to repair. So we're excited, obviously, in a non-devastating condition. So how do patients apply? I think most of you know the mechanism, but for us, it's really important, the science through all this, and we have our website where patients apply and review. We're trying to make it more patient-friendly. We've had recommendation from a lot of patients that sometimes it makes it harder, but we're improving that. And but the important thing is that we take each case individual and we review. We really look into the science behind it and our experience in determining if a patient is an adequate candidate. And we are really upfront with that. If we feel that the condition you have is really not worth it, we tell you, because I know there's a lot of false hope in what stem cells, we hear about it and we think it can help every condition, and unfortunately it's not the case. It might be in the future, but we're really realistic to what the literature is showing, what these trials are showing. In our experience, we probably are one of the most experienced clinics, and that's why we really talk to the patients about that. And so we have, again, a board that reviews all the cases, and then we decide what the best protocol for the patient is, and then that's how the process goes. So I think that the conclusions of all this is, if there's one thing I tell patients, is this therapy is safe. I think there's enough evidence to show, and we've discussed it already, that these are, in most cases, your own cells, and even when they're not your own, you don't reject them. So the worst thing that can happen is that the therapy doesn't work, but it won't worsen your condition, and it will not cause any untoward effect. And that's something, how do we know that in our case? Because we follow our patients, and that's also a big important thing. We are truly interested in the outcomes and improving ways to improve the therapies of what we do and the safety. So we really monitor our patients. We have a follow-up system. We have a physician fully dedicated on monitoring them. Obviously, it would be great following them personally, but obviously logistically makes it very hard, but we do it by phone calls and some patients when they come back. So that is a key factor that we differentiate ourselves from a lot of clinics doing this, that we truly are determined into improving the outcomes of our patients by the close follow-up. So we know it's a safe therapy. There is a lot of clinical trials, and that's really what a lot of physicians say, well, where's the evidence? Well, it's there. A lot of times it's hidden in smaller studies because of what we talked, that a lot of pharmaceutical companies are not interested in that, so we're not going to find big trials. But I think the evidence is so overwhelming that eventually this is going to be a matter of fact, and it's going to be simply something that's going to be done more and more even here in the U.S. As we mentioned, it's not a miracle cure, but it offers a great chance of improvement in a lot of these conditions where there's nothing else to be offered. And in my mind is no doubt the future of medicine, and I think that future is now. I feel really grateful that Panama is doing this, but I really feel it's going to be a worldwide thing in the near future. Well, thank you very much, and thanks for being here.